Gender-affirming surgery. We're going to bring in the waist with both lipo and rib remodeling, expansion of the hips as much as we can, silicone breast augmentation, and lipo of the neck. Alright, GAS, gender-affirming surgery. We're going to liposuction the whole back, waist, and part of the improvement in the waist is both from liposuction and the rib remodeling. This particular patient has interesting anatomy. She has a very short 12th rib. It's about 3 cms. So what we're going to do is we're still going to treat 3 ribs, but because 12 is short, it won't have any impact on contour, and we're going to treat then the 11th, 10th, and 9th.
My soul complete, rapture tastes so sweet. Me, amore, don't you know, my love, I want you so, yeah.
Before doing any rib procedure, we always get a CT scan. So this is a CT scan with 3D reconstructions. We count how many ribs there are. There's 12 ribs. One of our patients had 11. Then we measure out kind of where the angulation starts to really bend on the rib. So somewhere around here is the angulation, and we measure it out. It's about 8 to 10 centimeters. So this is around 8, this is around 10. And this is something, so when you break the bone, it's a monocortical fracture, meaning just the upper part's broken, but the part on the bottom is still intact. So it creates an angulation. When you heal, if you don't wear the garment, it's going to go back to this, right, straight. What you want to do is heal while the bone is angulated. That angulation is what allows, the angulation right here to bring in is what allows the waistline to narrow. That angulation is maintained by wearing the corset. Gender-affirming surgery, treatment of rib 11, 10, and 9. You can see really nice improvement in the waistline. So reduction in the waist, expansion of the hip. This waist to hip ratio now is going to be closer to 0.7. Her pre-existing or starting waist to hip was about 0.85, which is more in line with masculine physiques. As we get closer to 0.7, 0.6, it's much more feminine silhouettes. Challenging shape, but we made a lot of improvements in the waist to hip ratio. So we have expansion of the thigh with narrowing of the waist, which was accomplished with both liposuction and rib remodeling. We also performed a 600 cc implant augmentation, silicone implants, high profile, so you can see a nice hourglass silhouette. Gender affirming surgery, patient's BMI was 30. We did a 360 fat transfer to buttock and hips for expansion, rib remodeling. Any patient interested in rib remodeling, we get CAT scans before. CAT scans help us with anatomy. They're a roadmap. This particular patient had a small 12th rib, so we treated 11, 10, and 9. So we still did 3 ribs, but because 12 was small, really wasn't worth treating. It was about 3 centimeters. Thanks so much for watching. If you enjoy the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.